parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you hear 2 different extracts. In each extract, a health professional is talking to her patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Matagal. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Doctor.
Good morning. Please be seated. Can you tell me about your problem?
Doctor, since last year, I've been having double vision whenever I wake up in the morning. The problem lasts for 1 hour after I wake. When I close my eyes, the double vision dissipates. Over the past month, the double vision problem has worsened in intensity and frequency. I approached a local hospital in my town, and they referred me to the emergency department for an urgent MRI to investigate for possible aneurysm. There, I had a normal MRI and I was discharged to go home. By the next week, the double vision improved, although at present I'm still experiencing constant diplopia. In the past, whenever I saw 2 objects, they were very far apart in horizontal plane, but now the objects appear much closer together. I've stopped driving. I've also discontinued my job due to the diplopia problem. There's no temporal fluctuation to the double vision. Very recently, over the past week, I've developed supraorbital pain on the right side.
Your age?
51, Doctor.
Do you have any problems with swallowing or dysphagia?
No, Doctor.
Any weakness, numbness, tingling, or any neurological issues?
No, Doctor.
Do you have any difficulty in speaking or dysarthria?
No, Doctor.
Are you on any medication or allergic to any medicines?
No, Doctor.
Do you drink or smoke?
I do not drink, but I smoke.
Is there any family history of any illness?
My mother died of a stroke when she was 90. My father had colon cancer.
Well, your physical examination report shows your BP 124/76, heart rate 101, respiratory rate is 20. Your recent MRI report shows a questionable 3 mm aneurysm of the medial left supraclinoid internal corduroy artery. There is absolutely no abnormality on the right side. The blood flow patterns are normal and there is no blood vessel abnormalities. I think you have developed a condition myasthenia gravis or other disorder. Your right lid process. You have left gaze diplopia. The pupils are equal and reactive to light. Your neurological investigation is absolutely normal. There are possibilities of other extraocular abnormalities. You have horizontal diplopia in both directions, but there is no vertical diplopia. You have monocular diplopia.
Is it curable, Doctor?
Yes, of course. I would advise you to have a craniotomy and clipping done. This is a surgery performed to treat an aneurysm. However, you have to be very careful after the surgery because a rupture may cause you to lose your vision.
I think I should go for this surgery at any cost, Doctor.
You were right, Mr. Matagal. Extract 2, questions 13 to 24. You hear a physician talking to a patient called Mr. Medhigu. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Mr. Mahigu. Be seated. Tell me about your problem.
Doctor, I wanted re-evaluation of possible idiopathic normal pressure hydrocephalus.
Okay. What's your age now?
I'm 80, Doctor.
May I know when and how you developed this illness?
Well, it started 12 months ago. I had severe cognitive impairment, gait impairment and incontinence. Actually, I was evaluated in hospital at the time with CSF drainage via temporary spinal catheter, but there wasn't any significant response for that.
Well, your MRI shows you have cervical stenosis. It seems you also had a cervical laminectomy and instrumental fusion 6 months back.
Yeah, but there is no significant improvement. I think I've become worse now than I was a year ago. Practically, I'm unable to walk at all. I use both a walker and a support from an assistant to be able to walk or stand.
Do you have any headaches?
No, doctor. I think my memory has worsened.
What medication are you taking?
Aricept 10 milligrams in the evening, carbidopa 25 milligrams or levodopa 100 milligrams 3 times a day, citalopram 40 milligrams daily, Collis 100 milligrams twice a day, finasteride 5 milligrams once a day, Flomax 0.4 milligrams once a day, multivitamin with iron once a day, omeprazole 20 milligrams once a day, Senna 8.6 milligrams twice a day, Tylenol 650 milligrams as needed, and promethazine 25 milligrams as needed.
Your cranial nerve exam shows there is no up gaze that I can extract today. The down gaze and horizontal gaze are intact. Your gait is severely impaired. I have reviewed your CT scan of your brain and compared it to the MRI scan taken 8 months ago. Now I can see that the ventricles appear larger. The frontal hall span was previously about 5.5 centimetres and now it is 6 centimetres. The third ventricular span is 15 millimetres. I have come to the conclusion now that you have idiopathic normal pressure hydrocephalus. There is a possibility of supranuclear palsy, incontinence and urinary urgency. Although you have already had a CSF drainage via spinal catheter a year ago, I would strongly recommend that you repeat this now because there is further enlargement of the ventricles on the scan. I would also recommend a shunt surgery that would probably make a difference.
That is the end of Part A. Now, look at Part B.